Welcome to the PrepNet, presented every Sunday at 6 p.m. Eastern Time on Talk2Me's Channel 14. Come join us to discuss everything about prepping and hear what others have done. Medical Preparedness for Preppers Part 2. Disclaimer. Please be aware that this series on medical preparedness may include topics or descriptions that some listeners may find uncomfortable. This presentation is for educational and preparedness purposes only and is not medical advice. We will not go into graphic detail, but we will mention topics and areas you may want to research further as part of your own preparedness planning. Medical procedures should only be performed by properly trained individuals operating within their level of knowledge, skill, and legal authority. In a real emergency, seek professional medical care whenever possible. In Part 1, we discussed an introduction to medical preparedness and started the basic first aid supplies topic with organizing medical supplies. Let's continue with Part 2 of the basic first aid supplies topic and start with bleeding control. Severe bleeding can kill a person in minutes. One of the most important preparedness skills is learning how to control major bleeding. Every prepper should understand direct pressure, wound packing, pressure dressings, tourniquet use, recognizing internal bleeding, and recognizing shock. Trauma-focused supplies may include commercial tourniquets, hemostatic gauze, which is specially treated gauze designed to help blood clot faster and control severe bleeding when packed into deep wounds. Large trauma dressings, which are oversized sterile bandages designed to cover and protect major wounds while helping apply pressure to control heavy bleeding. Chest seals, which are specialized adhesive dressings used to cover penetrating chest wounds and help prevent air from entering the chest cavity through the injury. Trauma shears, compression bandages, emergency blankets, and eye shields. Tourniquets save lives when used correctly. Modern trauma medicine strongly supports early tourniquet use for life-threatening extremity bleeding. Cheap counterfeit tourniquets are a serious problem. If possible, purchase quality equipment from reputable sources and train with the same equipment you plan to use. There are links in the video description for quality tourniquets. Cardiac emergencies remain one of the leading causes of death. CPR training is a valuable skill a person can learn. An automated external defibrillator, or AED, can dramatically increase survival rates for certain cardiac arrests. AEDs are designed for ordinary people to use and provide voice instructions during operation. For most families and preppers, the goal is not to buy the most advanced AED. The goal is to buy one that a spouse, teenager, neighbor, or visitor can use correctly during a high-stress emergency. Preparedness groups, churches, community centers, and larger families may want to consider purchasing an AED if financially possible. There are links in the video description for quality AEDs for families and preppers. Important skills include recognizing cardiac arrest, performing CPR, using an AED, recognizing heart attack symptoms, and understanding choking response procedures. Fast action saves lives. Airway emergencies are extremely dangerous. A person who cannot breathe may die within minutes. Basic preparedness should include understanding choking response, recovery position, rescue breathing basics, recognizing respiratory distress, smoke inhalation dangers, and carbon monoxide poisoning symptoms. Additional supplies may include CPR masks, pocket masks, bag valve masks for trained users, pulse oximeters, links in the video description, and oxygen equipment for properly trained individuals. Carbon monoxide detectors are also an important preparedness item whenever generators, heaters, or combustion devices are used. Injuries become much harder to manage during disasters. A broken ankle during winter or a severe cut during a storm may prevent a person from working, traveling, or evacuating. Preppers should understand splinting basics, stabilizing fractures, treating sprains, safe lifting and movement, and spine injury precautions. Helpful supplies include SAM splints, which are lightweight, flexible aluminum core splints covered in foam that can be shaped to stabilize broken bones, sprains, and other limb injuries. Elastic wraps, slings, crutches, ice packs, finger splints, knee braces, and walking boots. Mobility injuries can rapidly reduce the effectiveness of an entire group. Burns are extremely common during emergencies because of fires, cooking accidents, generators, fuel handling, camp stoves, and improvised heating methods. Burns also carry a high risk of infection. Preparedness burn care may include burn gel, sterile nonstick dressings, clean water for cooling burns, pain control supplies, extra bandaging materials, and loose sterile coverings. People should understand the difference between minor and serious burns, when not to use ice, the dangers of infection, fluid loss concerns, and smoke inhalation dangers. Large burns are medical emergencies. Long-term emergencies often shift from trauma problems to disease and infection problems. Respiratory illness, gastrointestinal illness, contaminated water, and poor sanitation can spread quickly. Preparedness supplies may include fever reducers, electrolyte replacement, anti-diarrheal medication, oral rehydration salts, cough medications, thermometers, masks, gloves, disinfectants, soap, and water purification supplies. People should learn to recognize dehydration, fever, heat exhaustion, heat stroke, hypothermia, severe allergic reactions, and signs of infection. Simple sanitation measures may save more lives than advanced medical procedures. Dental problems become surprisingly serious during long emergencies. A tooth infection can become life-threatening if untreated. Preparedness dental supplies may include temporary filling material, dental wax, which is a soft, moldable wax used to cover sharp edges from braces, broken teeth, or damaged dental work to reduce irritation and pain inside the mouth. Clove oil, which is a traditional dental pain remedy made from cloves that may help temporarily numb tooth and gum pain and has mild antiseptic properties. Dental pain relievers. Floss, tooth extraction forceps for trained individuals, extra toothbrushes, and toothpaste. Good dental hygiene is extremely important because prevention is far easier than treating dental disease during a disaster. Next week, we'll continue with Part 3 of Medical Preparedness for Preppers. If you have any questions about what we have discussed here or anything about prepping, send your question to prepnetch14@gmail.com and enter question in the subject line.